we'll move on to other non-radiation and come back to radiation after this next one. But I think it's a very insightful question. So how will my oncologist know if I'm a candidate for radiation therapy? And I think as an oncologist, I'll humbly say that I ask my radiation colleagues a lot of the time as well. I think that's one of the advantages for you, right? We work in multidisciplinary groups. We have very close relationships, right? And so I never give a definitive answer about something, especially if a patient is particularly interested in radiation. I think it's best to speak with a specialist in that area.
Yeah, and I will say that, there are a lot of our community-based our patients who are going to community-based practices where they don't have the benefit of a multidisciplinary approach. And what I would say is that it really comes down to the medical oncologist who's following you. And if they think that you have benefited tremendously from a systemic therapy, and there are some limited number of lesions that, if we're treated, they could keep you on that same systemic therapy. As Dr. Bazhenova said, there's unfortunately diminishing returns with every subsequent line of systemic therapy. Then you should ask your medical oncologist to refer you to a radiation oncologist for that question, as Dr. Dagogo-Jack pointed out. And I think that's really the best approach.